What is empathy? Gosh, that's a complex question. Empathy encompasses a lot of different things. Essentially, it's taking yourself and kind of putting yourself in the patient's situation.
Treating everybody, every patient, like they're your mother, father, sister, and brother.
Sharing and understanding another's feelings or emotion.
Empathy is compassion,
kindness,
acknowledgement,
understanding.
Empathy means love.
Empathy means to me when somebody actually cares about my pain, that they're feeling what I'm feeling and they see me as not just a patient, but like their sister or their mother or their auntie, and they care about how I'm feeling. And that's what Castle does for me.
I believe you can learn how to be more empathetic. You can recognize that feeling within you to know that it has touched you in a certain way, and allow it to come out and go through you.
So I had a patient and she was very upset. She was mad at the hospital. She was mad at the doctors. She had no family here. And I could see it in her eyes that something was wrong. So she just wanted to shut the door and have everybody go outside, don't bother me kind of attitude. So I figure, okay, I'm gonna just sit down next to her. So I shut the door and I told her, can you tell me about yourself? She ended up crying, and we ended up talking about her, talking about me, and how good, that made her feel like I cared. So I cried a little bit with her, and then we hugged each other, and I got a lot out from just sitting with her for 10 minutes, just letting her know that I cared about what was going on with her.
Empathy, when you don't get it, you know that when you don't get it, you feel somewhat lost and alone, especially if you're in a vulnerable position. So when you do get empathy, it's a wonderful thing. You feel that somebody's connected with you, that somebody really gets you and understands you, and it makes you feel hopeful.
When I first came to Castle, I was a mess. In so much pain, I couldn't stop crying. I didn't know what was going on with me. And from the moment that they took me out of the car, into a chair, onto a bed, put in the IV, had the doctors come see me, it was seamless. And it's amazing how you feel that somebody actually cares. From that moment when you first get to Castle to the moment that they either release you and say, okay, we've done all we can do for you, or they put you in the hospital and take care of you, that to me means the world. It's why I will drive 40 miles to come to Castle and not go anywhere else.
Oddly enough, the extra 10 seconds that you take, it could be something as simple as acknowledging a family member that say, hey, I'm busy with this critical patient here, but you are important to me, and I will try to get that for you. And I think just conveying that and communicating that to them a lot of times will make a big difference. It's that little thing, like turning around and acknowledging somebody, making eye contact, touching them, shaking their hand. It's those little things that differentiate, I think, big outcomes with just doing run-of-the-mill healthcare.
Patients really need to have that compassion and that one-on-one interaction with the individual that lets them know that they're cared for.
And knowing that they have a story, they need to be loved and they need to be heard also. That's empathy.
If there was one thing that I could say about Castle Medical Center that makes the difference for me, is that when I walk in the door, I'm treated like somebody's favorite auntie. somebody's mom, somebody's sister. I'm not treated like a patient that's got a whine or that's hurting and they're just gonna try and get me in and get me out. They're gonna bring in a team and take care of me. That's the difference. That, I wanna say, is not a little difference, it's a huge difference because of all the other places I've ever been. That never happened. And I love you guys for that.